brought to you by Muskegon Family Care and Trinity Health.
As a diabetic, there are some important things you need to do to keep your feet happy.
What happens is diabetics can't always feel what's going on with their feet.
Ask for your foot check at every visit. Uncontrolled diabetics can't feel it when their feet get injured. Checking your feet can keep you from losing your toes. Controlling your blood sugar will keep you from losing feeling in your feet.
Patients with diabetes can lose feeling in their feet and not be aware of cuts and sores on them.
These can turn into serious infections that can spread through the muscle and even into the bone. To prevent this, we encourage our diabetic patients to inspect their feet, including the bottom of each foot and between the toes every day. If you can't quite reach there, you can use a mirror with a long handle to look as well. You're looking for any dark spots, cuts, cracks, calluses, or redness. You should expect your doctor to do a very thorough foot exam at least once a year and more often if you have problems with your feet. The first part of the exam is just an inspection, similar to the one you are doing at home. The second part of the exam involves an instrument called a monofilament. The purpose of this part of the exam is to be able to detect very early losses in feeling in your feet. It looks like a small piece of heavy fishing line on a handle. We will test it on your hand first so you know what it feels like. It doesn't hurt and it is a very light sensation. Next, while you are not looking, we will touch various parts of your feet. We will have you tell us when you feel the filament touching your foot. Being able to feel the monofilament reassures us that you still have a good sense of feeling in your feet and will be able to feel any cuts or other injuries well enough to take care of them. The best thing you can do to prevent ever losing toes or parts of your feet from diabetes is to keep your blood sugar controlled between 80 and 120 and keep your hemoglobin A1C under 7. The next important thing is to check your feet every day. So remember to baby those feet and keep them soft and smooth every day.
You got to take care of your feet. You got to keep the skin so it's not dry and cracked.
What went through my mind when I found out, I was wishing I was dead. I'm 53 years old. I went in that bedroom. I slammed the door behind me and locked the door. And I went in there and I cried because I could not believe it, that I was losing my leg. This is what it looks like. I'll never have another leg down there. This is what it looks like. If you don't want one like this, then please follow the instructions that your doctor gives you.
The most basic thing that a patient can do in regards to their feet is check them every day. Follow your doctor's orders. Get yourself into good therapeutic shoes, good foot orthotics. And seeing me, that's another set of eyes that are going to see your feet, and possibly I'll be able to catch something before it escalates into a problem later down the road for you.
We can save people's feet. They don't have to lose their feet. And through our help and the help of our podiatrists, we can really make a difference in our diabetics.
Check your sugars, check your feet, keep your toes.